Protection against electromagnetic waves hypersensitivity with Immun'Âge FPP.
Hello, I'm Dr. Pierre Montello, Director of the Osato Research Institute, and I'm going to present the benefits of Immun'Âge for people suffering from hypersensitivity to electromagnetic waves.
Hello, I'm Amelie Montello, Scientific Researcher and Communication Manager of Osato Research Institute. Immun'Âge is a fermented papaya food supplement that helps electro-hypersensitive people improve their quality of life by relieving many of the clinical symptoms caused by the electromagnetic fields generated by wireless telecommunication technologies.
Electromagnetic field intolerance syndrome is an extreme reaction to low-level exposure to electromagnetic fields called EMFs, emitted by wireless telecommunication technologies. Under EMFs, neuroinflammation could occur in the brain, associated with vascular hypoperfusion. Both could induce oxidative stress. This oxidative stress could amplify the inflammatory process, leading to a vicious circle. This acute oxidative stress amplifies the inflammatory process, leading to dysfunction of the blood-brain barrier, which in turn can induce various neurodegenerative diseases. These dysfunctions can be manifested by various clinical symptoms such as headaches, fatigue, cognitive impairment, insomnia, or attention deficit.
Since 2009, I've been treating patients in environmental medicine. I have diagnosed over 3,000 electro-hypersensitive patients with electromagnetic field intolerance syndrome, known as EMFIS. The clinical criteria were not specific, but we could diagnose people with EMFIS using biological markers and medical imaging.
Clinical criteria are diverse, and alone cannot make the diagnosis of intolerance to electromagnetic fields. At the onset of the disease, the most frequent are tinnitus, headaches, dysesthesia, and dizziness. When intolerance is established, we have found other symptoms such as episodes of tachycardia, cognitive impairments, insomnia, mild depression, and fatigue. These symptoms are not specific for the diagnosis of EMFIS. Professor Belpum has found biological markers in the blood that are affected by electromagnetic fields, such as antithermal shock proteins 27 and 70 associated with autoimmune disorders. S100B correlated with opening of the blood-brain barrier. And histamine, a marker of neuroinflammation.
Transcerebral ultrasound cerebral tomosphygmography, TSCU, as known as transcerebral pulsatile echography. Detection of the cerebral pulse by means of an ultrasound transceiver probe operating in pulsed mode at 2 MHz. This probe is positioned supraauricularly and perpendicular to the sagittal plane of the skull. Prototype developed by Dr. Le Petit at Limoges University Hospital. Approved since 1993, marketed under the name encephaloscan.
The encephaloscan allows us to visualize vascular flow and oxygenation in different parts of the brain, enabling us to define a cerebral profile. Patients diagnosed with EMFIS have an abnormal encephaloscan result, showing hypopulsatility in certain regions of the brain, reflecting reduced blood flow and hypoxia that can lead to deterioration of brain cells in these areas.
Here's a typical median encephaloscan performed on 47 subjects diagnosed with electromagnetic field intolerance syndrome. The black grid corresponds to the values of normal subjects. Compared with normal subjects, the hypopulsatility of different brain areas in patients with electromagnetic field intolerance syndrome, EMFIS, can be visualized.
Immun'Âge FPP is our solution for relieving the symptoms of electromagnetic field intolerance syndrome in electrosensitive patients. This study, led by Professor Belpam, shows the benefits of Immun'Âge FPP in electrosensitive patients. It was published in Functional Foods Health and Disease in 2018. Proof of Immun'Âge FPP action on clinical symptoms observed in the study. Most patients in the study had high levels of fatigue, with over 65% reporting severe fatigue at the start of the study with severe and/or permanent symptoms. After 6 months of taking Immun'Âge FPP, a significant reduction in fatigue was observed. Fatigue was reduced in 82.3% of patients.
Clinical improvement of tachycardia by Immun'Âge FPP. You noted that the number of patients with tachycardia episodes fell after 6 months of Immun'Âge FPP intake, as did the number of episodes per patient. Average improvements by symptoms are shown here. The best improvements were found for fatigue, attention deficit disorder, general cognitive impairment, short-term memory, insomnia. Other improvements are concentration difficulties, tinnitus, mild depression, headaches, dysesthesia. Blood markers associated with electromagnetic field intolerance syndrome, EMFIS. The values of the following 4 blood markers decreases significantly after 6 months of Immun'Âge FPP supplementation. Antibodies against heat shock proteins 70 and 27, markers of autoimmune disorders. S100B proteins linked to opening of the blood-brain barrier, BBB, and cerebral hypoxia. Histamine, which leads to neuroinflammation. Elevated values of these blood markers confirm electromagnetic fields intolerance syndrome, EMFIS. Their reduction after taking Immun'Âge FPP shows its action, which contributes to the well-being of electrosensitive patients.
In 2018, before using the encephaloscan, TSCU, we calibrated it on 28 normal patients in order to compare our normal values with those of Dr. Petit, 1985, in a hospital setting on 150 patients according to strict inclusion criteria: no vascular or neurological disorders, no intake of substances involving vasodilatation or vasoconstriction. Approximately the same perfusion levels were found in all brain areas. Together with the biological and clinical criteria, encephaloscan imaging helps to confirm the diagnosis of electromagnetic field intolerance syndrome. Here are a few examples of results from patients diagnosed with SISM. First of all, that of a 40-year-old woman, where you can see a big difference in pulsatility compared with normal imaging. Here is the example of a 40-year-old woman with a very disturbed encephaloscan, showing a bad perfusion of different part of the brain. Here is the example of a 54-year-old man with a very disturbed encephaloscan, showing also a bad perfusion of different part of the brain.
As we have already seen, encephaloscan allows us to visualize vascular flow and oxygenation in different parts of the brain, enabling us to define an encephalic profile. This technique demonstrates the clinical and biological reality of EMFIS. After 3 months of supplementation with Immun'Âge FPP in patients suffering from EMFIS, an improvement in cerebral perfusion has been observed. After 6 months of supplementation with Immun'Âge FPP, the vascular flow of patients with EMFIS returns to normal values, with normalization of brain oxygenation. After this 6 months of this FPP supplementation, 50 to 85% of patients have a diminution of their clinical symptoms. Electromagnetic field intolerance syndrome (EMFIS) has major consequences for the brain, which can lead to neurodegenerative pathologies. Encephaloscan and blood tests allows to highlight the alteration of biological markers in electrosensitive patients, notably cerebral hypoperfusion, imbalance in redox status and blood markers associated with EMFIS. After 6 months of Immun'Âge FPP supplementation, this study showed that it restored normal cerebral perfusion and reduced clinical symptoms.
Immun'Âge FPP helps to alleviate patients suffering from electromagnetic field intolerance syndrome, EMFIS. Classic FPP use for protection against the electromagnetic field intolerance syndrome. Dosage: 1 to 3 packets per day depending on number and severity of symptoms. Action: diminution of oxidative stress and inflammatory phenomenon and normalization of brain oxygenation. Result: diminution of number and severity of clinical symptoms. Headache, fatigue, tachycardia episodes, insomnia, attention deficit, tinnitus, mild depression, dysesthesia, short-term memory, general cognitive impairment. Thank you for your attention.